Good morning. Grab your coffee, settle in, and let's look at a number that's going to make your morning commute feel a lot shorter. $26,450. That's not the price of a mid-sized sedan or a luxury watch. It's the average annual health insurance premium for a family in 2026. If you're looking at your paycheck and wondering where the money's going, well, there's your answer. It's a record high. It's a mountain of cash. And yet, here's the kicker. Despite paying more than ever, the one thing you actually want, a human doctor, has never been harder to find. Think about the last time you tried to book a specialist. The average wait time is now 38 days. That's over a month of waiting for an opening while you navigate a phone tree that sounds like it was programmed by a robot having a midlife crisis. We're looking at a global healthcare burden projected to hit $14 trillion annually. $14 trillion. That's roughly 13% of the entire planet's GDP. We're spending more on care than at any point in human history. But the human part of that equation? It's disappearing. It's being phased out, optimized away, and replaced by something much cheaper to maintain. An algorithm? Here's the deal. You're paying for a premium service, but you're getting a digital substitute. It's like buying a ticket for a live concert and being handed a pair of headphones to watch a live stream. The system is decoupling the price you pay from the cost of the labor it provides. This isn't just a glitch in the system, it's the new business model. We've entered the era of the human trap, where the masses are funneled into automated loops while the actual experts are quietly exiting through the back door. Let that sink in for a second. While your premiums are going up by 10% a year, your access to a living, breathing MD is dropping just as fast. So, where are all the doctors going? It's not a mystery, it's a migration. We call it physician flight. Right now, we're looking at a projected shortage of nearly 97,000 doctors, but they aren't all retiring. A huge chunk of the best ones are simply opting out of the insurance game. They're moving into the concierge medicine market, which just hit $25 billion. These doctors are tired of the paperwork, tired of the 12-minute appointments, and tired of being told what to do by a software program. So they charge a subscription fee, often thousands out of pocket, just to guarantee they'll actually see you. Now look at what's filling the void they left behind. It's the algorithmic substitute. The AI healthcare market is exploding, up 145% in just 3 years. Companies are marketing this as efficiency and 24/7 access. They'll tell you that a chatbot is better because it never sleeps and has read every medical journal ever written. But let's be real, they aren't hiring AI because it's a better healer. They're hiring AI because software doesn't ask for a salary, it doesn't get burned out, and it doesn't have a soul that gets tired of denying claims. It's a shiny algorithm designed to protect the bottom line. I know it sounds a bit dramatic, right? But look at the data. When a corporation can replace a $300,000 a year cardiologist with a $10 a month API call for the initial triage, the profit margin doesn't just grow, it leaps. We're seeing a massive shift where healthcare is being redefined as data management. If your case fits the standard curve, the algorithm handles it. If it doesn't, well, that's where the wait times start to climb. This is the part I find wild. We are witnessing the industrialization of the most personal interaction humans have, and we're paying a $26,000 cover charge just to get in the room with a computer. Okay, let's talk about the real problem. The one nobody mentions at the dinner table, it's the margin gap. This is how the giants, the managed care organizations, and the private equity firms are winning. They've figured out how to charge you human tier premiums while delivering low-cost digital services. It's a masterclass in vertical integration. They own the insurance company, they own the pharmacy benefit manager, and increasingly, they own the software that decides if your surgery is medically necessary. It's a closed loop, and you're on the outside looking in? Here's where it gets strange. Have you noticed how insurance claim denials are suddenly through the roof? The AI automated denial rate is now over 17%. That's a 42% jump in 3 years. Why? Because algorithms are being used to perform prior authorization at a scale no human could ever match. They can scan thousands of claims and find a reason to say no in milliseconds. It turns healthcare into a high-margin software business. If they can automate the no, they keep the cash. It's that simple. Private equity isn't buying clinics to hire more nurses. They're buying clinics to install better automation assets. This is the part you need to pay attention to. The system is moving toward a default to digital model. If you're a standard patient with a standard problem, you will never see a doctor. You'll talk to a screen, you'll get a prescription from a bot, and you'll be told you're getting the latest technology. But if you're wealthy, if you can afford that $25 billion concierge market, then, and only then, do you get the luxury of human eye contact. We are literally putting a price tag on the human touch. And honestly, this is the most interesting and perhaps the most cynical structural shift in the modern economy. Now, let's zoom out for a second. Believe it or not, we've been here before. Flashback to 1910. The medical world was a mess, so they commissioned something called the Flexner report. The goal was to standardize medical education. It sounded great on paper, it closed the diploma mills and ensured every doctor was properly trained. But it also forcibly closed 50% of the medical schools in the US, creating an artificial scarcity of doctors that we are still feeling today. It made the MD degree an elite, restricted asset. It professionalized medicine by making it scarce. Fast forward to today, and we're seeing Flexner 2.0, but this time the tool isn't a report, it's AI. By defining standard care as something that can be delivered via an algorithm, the system is reclassifying human-to-human medicine as an unnecessary outlier. It's the same playbook: standardize the masses and reserve the real version for the elite. If the world's largest pension funds and private equity groups are pouring billions into automated care, what does that tell you? It tells you they view human labor as a liability to be minimized, not an asset to be cherished. The direct primary care movement, which is people opting out of insurance to pay their doctors directly, is growing like crazy. It's up 55%. People are literally paying twice just to bypass the algorithm. They pay their employers $26,000 premium, and then they pay another $100 a month to a local doctor just so they can have their cell phone number. That's the middle class trying to buy their way out of the trap. They've realized that in a world of $14 trillion healthcare, the most valuable thing you can own isn't a gold-plated insurance card. It's a relationship with a human being who knows your name. So where does this road end? We're looking at a future of tiered humanity. In the next decade, your health plan won't just dictate which hospital you go to or which pharmacy you use. It will dictate whether you talk to a person or a processor. Human-centric medicine is becoming the new gold standard of wealth, right up there with private jets and off-market real estate. If you're on the standard plan, you get the bot. If you're on the premier plan, you might get a nurse practitioner via video. If you're at the top, you get the undivided attention of a specialist who isn't looking at a timer. The math is brutal. Medical inflation is consistently running above core inflation. Physician burnout is at 62%. The system is buckling under its own weight, and its only solution is to automate the empathy out of the room. By 2040, mental health costs alone are projected to hit $14 trillion. Think about that. We are building a world that is so automated and so isolating that it's creating a $14 trillion crisis of the mind. And our solution is to give people more chatbots to talk to about it. The irony is almost too much to handle. Here's the bottom line. In the automated economy of tomorrow, the ultimate luxury won't be a faster car, a smarter phone, or a bigger house. It will be the undivided attention of another human being. When you see that $26,000 deduction on your next statement, don't just look at the number. Ask yourself what you're actually buying. Are you buying a cure? Or are you buying a subscription to a system that has already decided you aren't worth the time of a human doctor? In the end, the system knows the price of everything, but the value of nothing. Think about that next time you're on hold.